Hello, I'm Cam Bennett, and I'll be taking your blood pressure today. Um, First, I would like to walk through four just things of paperwork with you. First is our informed consent, which you can sign, and you can stop the test at any time you're uncomfortable. But it just says you know and understand and agree with what's taking place. In this instance, it would be blood pressure. Then there's our Part Q test, which is just a questionnaire of 7 questions, general health questions that you would fill out on your own. And then there's medical history. So do you have any history of diagnoses, surgeries, family history?
I have a family history of high blood pressure.
Okay. And then we would take all that information and plug it into an algorithm which clears you for a certain level of physical activity and determines the intensity that you're allowed to participate in physical activity. So before I take the blood pressure, I would let you sit here for 5 minutes to make sure that your resting blood pressure is at the correct level and it's not elevated. And every time after I take your blood pressure with the cuff, I would let it rest for 1 minute so it would go back down to regular resting blood pressure. But before I find the blood pressure, I would put on the cuff, which I will do in a few minutes, and find the maximum inflation rate. So I would put the cuff on 80% of the arm, inflate it until I cannot feel the radial artery beating, and then add 20 degrees of mercury to that number, and that would be the maximum inflation rate. So I'm going to do that right now. Is it okay if I touch you?
Yes.
Okay. Place your arm right there. Make sure the blood pressure cuff is covering 80% of the arm. And find the radial artery with my 2 fingers. There it is. Increased it to 140 and couldn't feel it anymore, so add 20 degrees of mercury to that, and it would be 160 is the maximum inflation rate. Now I'm going to let it rest for a minute before I take her blood pressure again. And while I do that, I'll go over how taking blood pressure would be different between resting and then exercise. So during resting blood pressure, you have your person sit down, feet uncrossed on the floor, flat on the floor, arm elevated about heart level, flat, and you would let them sit there for 5 minutes, as I said before. And then you put the cuff on 80% of the arm, inflate it to the maximum inflation rate, and put the stethoscope on the antecubital fossa. When I increase it to the maximum inflation rate, slowly decrease it 2 to 3 degrees of mercury down until I hear the first beat, thump of the heart. And then that would be your systolic blood pressure, and then decrease it until you hear the last one and can't hear it anymore, and that will be your diastolic blood pressure. So for when I'm finding exercise blood pressure, you would have the person, whether they're on a bike or a treadmill, you would put their arm either on your shoulder or tight in your armpit, just to secure it. You would put the cuff on the same way, same placement of the stethoscope in the antecubital fossa, but you would increase the cuff to 200 millimeters of mercury, instead of, in this case, 160 for the maximum inflation rate. And then you would decrease it by 4 to 5 millimeters of mercury instead of 2 to 3. And that's how you would take it for exercise blood pressure. So now I'm going to take her blood pressure for the first time, and then give her a minute rest, and then take it one more time, and then that will be good to go. For your first reading, your blood pressure was 120/78, which is normal, so there's no risk of high blood pressure, hypertension, or pre-hypertension. That's exactly where we would like it to be. So blood pressure is normal. And now you just let it rest for a minute. One thing is that depending on your diet, if you eat a lot of fast food or a lot of junk food, that can increase your blood pressure, cause hypertension due to sodium intake. We want to keep our water intake high as well, because that can help with blood pressure, and exercise can also affect blood pressure. Blood pressure rises when we exercise, but obviously that's natural, such as breathing and whatnot. But chronic exercise helps lower blood pressure, as well as a good healthy diet full of vegetables, fruits, lean proteins, and adequate water intake. So it's been about a minute, and I'm going to take her blood pressure one more time, and that will be it for today. That time it was 119/80, which is normal. And that's about it. Any questions?
No, thank you.
Sweet. Thank you.